Heart attacks don't start in the emergency room. They start years earlier, oftentimes quietly, long before you develop chest pain, long before you get to the hospital, long before you dial 911. And cholesterol plays an integral part of that story. High cholesterol. You've heard about it. Some of you may have been told that you have it or a family member who does. But what does it actually mean and why should you care? Today, we're going to talk about just that. High cholesterol, what it is, why it matters, and how prevention begins long before the crisis. This is an episode you don't want to miss. So buckle up and let's get into it. Welcome to Fuller Living, your space for empowerment, inspiration, and practical health nuggets. Here you'll find relatable guidance that fits your everyday life as you journey to a fuller and healthier you. I'm your host, Dr. Ashitey. Let's dig in. Welcome to Fuller Living. Wherever you are, whether you're out for your morning drive or commuting to work, jogging, walking, maybe you're working in the yard with your headsets on, maybe you're taking a quiet moment for yourself. As always, I am so glad you're here because you have chosen your health. You have chosen to invest in yourself today. Today, we're continuing part 3 of our cardiometabolic health series. We've talked about high blood pressure, we've talked about diabetes, and today we're talking about cholesterol. Over the years, I've seen so many patients with high cholesterol. Some of them have required medication. Some of them we were able to manage through lifestyle changes alone, but many were somewhere in between. But one thing I can say confidently, most people have a complicated relationship with this diagnosis. For some, it's frustrating, especially when you feel like you've tried everything. You've changed your diet, you've exercised, you've lost weight, and the numbers still won't move into the normal range. For others, medication works until they stop it, and then the numbers just climb right back up. And I've heard people say this sometimes casually, sometimes with defeat in their voices. It's always been like that, as if to say this is just their destiny. Today, I want to bring you some hope by bringing in some understanding. I want us to understand what really is high cholesterol. What do those numbers mean? Why sometimes lifestyle change works and why sometimes you might need some medication. What role does your genetics have to play? And most importantly, where hope actually fits into the equation. So let's go back to the beginning. Cholesterol, what exactly is it? Is it just another number on your lab report or a red flag in your patient portal? Or is it that thing you're going to have for the rest of your life and that's just it? What exactly is it? Cholesterol is a waxy fat-like substance in your body and your liver produces most of it. I know that's surprising, right? You're probably wondering, you mean to tell me that my own body makes cholesterol? Yes, because when we often think of cholesterol, we often think of it coming from food. Well, it's not just from our food, our bodies make it as well. Even if you ate perfectly, your body would still make cholesterol. And that's because cholesterol is necessary. Every single cell in our body uses it as part of its outer structure. Your body also uses it to make hormones, we use it to make vitamin D, and it even plays a role in digestion. Cholesterol is not the enemy. The problem isn't that it exists. The problem is what happens when we have too much of it circulating in our bloodstream over several years. Very much like the blood sugar episode, we touched on the fact that glucose, sugar, was not the actual enemy because it is our primary source of energy. But the problem becomes when we have too much of it circulating around in our bodies. Check out the diabetes episode if you haven't already. The same applies for cholesterol. Its presence is essential, but too much of it becomes a problem. And here's why that matters. Your arteries are lined with a smooth inner surface. Think of it as a brand new pipe. It's clean, it's open, it's flexible. Blood can flow through very easily. Oxygen gets where it needs to. But as cholesterol moves through the bloodstream, these particles can start to stick to the surface. At first, it's microscopic, not a big deal, no symptoms. But as the body recognizes that, it sees it as something else and responds to it with inflammation. Over time, that area becomes thicker, and what was once a wide, flexible artery slowly becomes more narrow and stiffer. This process can gradually occur over decades. That narrowing is going to reduce blood flow. And if a piece of that buildup ruptures, it forms a blood clot. And that suddenly blocks off flow. That's how you get a heart attack. That's how you get a stroke. That's why cholesterol matters. It's not just another number on your lab. It's about what that number or what those labs are doing inside your arteries over time. High cholesterol can be so frustrating because for many, it's a lifelong issue. I hear you say, my cholesterol is high, and you immediately think, but I don't eat fried foods and I exercise regular and I've lost weight. So why is that the case? And it can feel confusing as some people even take medications, but even then it can feel like you're not getting where you want to be. But we can't treat cholesterol like it's a morality test. It's just biology. And to understand it, it might help us to follow these particles as they travel through the blood vessels. So let's do that. Cholesterol doesn't dissolve in the blood, but it still has to travel to its destination to get its job done. The making of the vitamin D and making your hormones, et cetera, et cetera. So to solve for this problem, our body packages it up into particles that move through the bloodstream, LDL and HDL. You've probably heard about them. They're carriers. LDL carries cholesterol from the liver out to the tissue, and HDL helps transport cholesterol back to the liver, gets it out of the blood. You've probably heard of LDL as your bad cholesterol, which is useful because generally we want to lower it. But at a fundamental level, even this type of cholesterol has a vital role to play. Remember, it's getting cholesterol from the liver to the tissues where it's needed. The issue is when there's too much of it circulating in the bloodstream for too long, because over time, these particles are going to settle into the lining of the arteries, and that's how the buildup begins. You can see why we'd want to lower your LDL and why we've infamously named it the bad cholesterol. On the other hand, since HDL returns cholesterol to the liver and out of the bloodstream, it's considered the good kind because it helps us avoid that buildup in our arteries over time. I hope this helps. This process, the process of building up in the arteries, it doesn't happen just overnight. It happens over years. That's why we feel fine while quietly things are happening inside our arteries, even now as we speak. Now, not all cholesterol particles behave the same. Some of them are more likely to settle into your blood vessel wall. One of those particles is called lipoprotein little a. Lipoprotein little a is similar to LDL, but it has an additional protein attached to it. And this additional protein makes it much more stickier. It's more likely to attach to your blood vessel wall and cause inflammation and lead more to blood clot formation in the vessels. So, the combination of that stickiness and increase over time increases a person's cardiovascular risk if they have a high level. That is, they have a higher risk of heart attacks and strokes. And unlike your standard LDL, lipoprotein little a is largely inherited. So lifestyle modification alone doesn't lower it significantly. Let me share a patient story with you. She came to see me with an LDL cholesterol of 155. Usually we want it below 100. She was healthy, she exercised, she wasn't overweight, she ate relatively well, but she was so frustrated. I don't understand, she told me. I'm doing everything I'm supposed to, everything that you've told me to. So I said, okay, well, let's make a plan. So we adjusted her nutrition a little bit more intentionally. We increased her fiber. We focused on consistency. And this is a type A patient. She followed through. On her follow-up lab report, her LDL level came down almost to normal range. And this time I included a lipoprotein little a level, and that's what shocked me. Her results came back and it was significantly elevated. So I asked her for some more information, and that's when she shared. Her father had a history of multiple strokes. In fact, he had some of them in his early 50s. This is not random. She was at a higher risk of heart disease compared to her peers. This helped us understand that her risk wasn't just about diet and exercise. It was about her inherited biology. And once we knew that, we were able to adjust our plan. We became more intentional about her blood pressure goals. We were more attentive to even other metabolic markers, and we were able to have more thoughtful conversations about medication. This knowledge empowered her. The good thing is that there's more research coming out about lipoprotein little a and what medications can do. We already have some classes of medications that can make a difference, but I only think it's going to get better. So we need to add this to the conversation because all risk is not the same. Now let's get to my favorite part. What can we actually do about this? Understanding your cholesterol isn't about memorizing some numbers. It's about reducing your overall risk of heart attacks and strokes. Because at the end of the day, that's what we're really trying to prevent. It's not about getting a perfect number. So, if cholesterol contributes to building up in our arteries over decades, guess what? We need to start preventing that buildup in our pipes decades before it happens. We need to be acting now. So, here are 3 things you can do now to help decrease your cholesterol numbers and protect your heart as well as your brain and other organs that rely on blood supply. Number 1, reduce how many cholesterol particles are circulating. Number 2, protect the lining of your arteries. And number 3, we need to reduce the inflammation that helps accelerate that buildup. So back to number 1, reducing the circulating particles. This is where our nutrition really matters, like increasing fiber in your diet, reducing those highly processed and inflammatory foods. All of these can improve your cholesterol profiles. When it comes to protecting the lining, number 2, we can do things like control our blood pressure, avoid smoking. It is the worst thing a person can do for their arteries, and manage your stress. Yes, stress plays a huge and integral role. And so managing it is also protecting your arteries. Number 3, reduce inflammation. Control blood sugar levels because that can increase inflammation, increase movement, and improve your sleep. It sounds simple, right? Eat right, sleep well, manage stress. It's always the same thing, but it matters and it's true. The key here is that we have to stay consistent. Over years, these lifestyle changes can reduce the chance of that buildup and it can reduce the chances of a heart attack and stroke. Now, there are some people, however, and this is very important, that lifestyle change may not be enough for. Remember, we talked about the people with the hereditary lipoprotein little a who have a slightly higher risk or maybe a moderately higher risk than the average population. For some people like this, just your diet and exercise may not be enough because of that strong genetic factor. So, this is where medication may be necessary in the long term. Again, it's not a failure, but a way to further reduce your risk based on what you inherited. So, if heart disease builds quietly over time, you don't wait for symptoms to occur. Know your cholesterol numbers now. Know your blood pressure, know your blood sugar. Ask about lipoprotein little a. This is where it all starts. Ask about your family history. Know who's had a heart attack, who's had a stroke. Not just that, how old were they when it happened? Because if someone had a heart attack and they were 70 compared to someone who had a heart attack in their 50s, that's telling us a completely different story. And it advises me as a doctor and other clinicians on how to better screen you and help decrease your risk. So ask the questions, know your numbers, because prevention starts with awareness. We're now at the part of our episode where we get into our SMART goal. Remember, a SMART goal is one that is specific, it's measurable, attainable, relevant, and time bound. So, for specific, if you haven't already, schedule your physical or an opportunity to get labs. Measurable, we're just scheduling our appointment. achievable or attainable. This is just one phone call or one online booking. Most of us should be able to get that done. Relevant. This is because early detection is going to decrease your risk of a heart attack and stroke, and this is part of your overall goal to live a healthier and fuller life. Time bound. Let's do this over the next 7 days, and that's it. Now, if you already know your numbers, maybe your goal could be to have a conversation with your family to better understand your risk. Who's had a heart attack? Who's had a stroke? How old were they when it happened? Prevention doesn't happen by accident. It happens with intention. Understanding cholesterol isn't about fear, or it shouldn't be. It's about awareness. Heart disease doesn't begin with chest pain. It begins years earlier, quietly, inside the arteries. And the good news is that we can modify that risk. You cannot change your genetics, but you can influence the trajectory that your life takes and reduce your overall risk. So, if this episode helped you understand cholesterol differently, share it with a friend, someone with your life, a parent, sibling, anyone you care about. People need to hear this. Make sure you're also following this podcast so you don't miss the final episode of our cardiometabolic series, where I'm going to put it all together and talk about heart disease itself. And if you're enjoying this series, please take a moment to give me your 5-star review. This is going to help me pass this information to more and more people. Until next time, let's get to fuller living. Well, fam, that wraps up another episode of Fuller Living, where we talk about health in a bite-sized, relatable, practical, and fun way. Remember, it's not about being perfect. It's about making progress one small step at a time while remaining consistent. If you found this episode helpful, please subscribe, share it with a friend who might need a little bit of inspiration, and leave me your 5-star review. And if you're in Dallas and looking for a new PCP, look me up at southwestfamilymed.com. I can't wait to meet you. Until next time, let's get to fuller living.